songs for you right now. I read somewhere that King Sunny Ade had stated that he heard a piece of music and knew immediately that it was my sound. And that comment blew me away because, to me, the greatest flattery that anyone could say was that I have a unique sound, and that's what I'm working for. That's my goal, is to come up with something that's different and my own.
Good evening, everyone. Please turn off all cell phones as this is a live event on YouTube and on television. Thank you.
Welcome to the Men's Health Matters Man Up Checkup Information Session with a focus on prostate cancer awareness. The event is hosted by the St. Martin Lions Club in collaboration with the Positive and Electrolytes Foundation. And here are your hosts for the evening, Shelly Alfonso, President for Positive Foundation, and Mercedes Electra van der Waals Wyatt, President of the Electrolytes Foundation.
Good evening, ladies and gentlemen, viewers online, and to all our wonderful audience, distinguished guest speakers. Good evening to you all, and our honorable member of parliament in the audience as well. Have to also acknowledge President from the St. Martin's Lions Club, Alphonse Gums. We are very happy to have so many men here this evening. My name is Mercedes van der Waals Wyatt, also known as Electra. I am the president of the Electrolytes Foundation. Welcome to the St. Martin Lions Club Health Matters, and also in collaboration with the Positive and Electrolytes Foundation for Prostate Cancer Awareness. I would like to also introduce my co-host for the evening, Miss Shelley Alfonso.
Good evening, everyone. Thank you very much for coming out this evening. It is indeed a pleasure for us to be here and to work together with the St. Martin Lions Club. While protocol has been established, we would still need to acknowledge all the district governors present for this particular evening, for this event as well. We will, this evening, have a number of speakers. The first speaker tonight will be Dr. Rojas. That will be followed by Michael Ferrier, followed by Mr. Benjamin. We will then have Mr. Rolox, and then we will have a surprise, which was not announced publicly, but will be now, Mr. Mike Van Krieken, as well as one of our presenters this evening. After the presentation, there will be a time for you to ask questions, both in-house, in person, as well as online. Thank you very much for coming out to this session. I know it's Saturday, and we promised for it to be both educational, informative, and fun as well. So thank you, and we move on with our first speaker. I believe Mr. Jimmy Challenger will come to introduce our first guest speaker.
Good evening, everyone. It's a pleasure to be here as the chairman of the Health Committee for the St. Martin Lions Club, and to basically set the tone as to what we're doing this evening, which is basically to educate the public, inform men in particular and their extended families of the taking care of our prostate as men. With that in mind, we have invited Dr. Carlos Ramos to be our first Rojas, gracias. Dr. Carlos Rojas is a urologist currently at the St. Martin Medical Center. He joined the medical team of the SMMC in 2018. He accomplished his studies at the University of Venezuela, La Universidad Central de Venezuela, where he obtained his major in urology and general surgery. He has 19 years of experience in the field of urology, and prior to becoming a member of the SMMC team, he had over 19 years experience, of which 10 years he ran his own medical practice in Venezuela. Urological complications include pelvic floor dysfunction, pelvic organ prolapses, urinary incontinence. These are some of the areas that Dr. Rojas has specialized in, and I ask you kindly this evening to join me in welcoming him to the podium to make his presentation.
Wow. Thank you very much. With that presentation, I always say that I'm blessed to be here in San Martin to help all your people. Thank you for the Electrolytes Foundation, the Positive Foundation, to invite me to speak about prostate, and also thank you very much for the Lions Club for have some such beautiful evening here. So I'm going to start. I'm not trying to give you too many information. I'm going to start to speak simple, so you can understand what is the prostate, no? And what what are the diseases of the prostate, especially prostate cancer. So, next one, please. So this is the prostate is located in the deepest part of the abdomen, is under under the bladder, and it's part of the urinary tract. So the prostate surrounds the urethra. What you see is the gray gland that you see over there is like a walnut. The normal size of the prostate is like a walnut. The next one. What's the function of the prostate? The prostate is a reproductive gland, so it's very important for reproduction. So, and it's the secretion of the prostate. It's part of the seminal fluid. So to support the sperm cells is very important. The prostate for fecundation, for conceive. Next one. So this is the prostate. The prostate has three major zones. Has the peripheral zone. 70% of all cancers are in the peripheral zone. So that's the reason it's very important to do the digital rectal exam, because we can access that peripheral zone with the finger. Also, we can see 25% of cancers in the central zone. That one is very difficult to access with the finger, and the other 5% is in the transitional zone. The transitional zone is the zone that grows in BPH. Next one. So the speaking about prostate cancer is the leading cancer between males. It's a major cause of cancer in the world between men, and also is the second cause of death in cancer between men. Is very common in Western countries. So next one. You see so we're going to see that there's an environment condition that affects that can become in prostate cancer. But you see, we can see that in the age of diagnosis, it increased after 40 years old. The next one. And we can see also how cases of prostate cancer had increased in time. Next one. So what are the risk factors to have prostate cancer? First, the age. The age, all men after 45 years old needs to be checked, because age is a factor to have prostate cancer. Secondly, the race. Afro-Caribbean, Afro-Americans, they have high incidence of prostate cancer. Also, cancer is more aggressive. And third, the family history. If you have in your family past history of prostate cancer, even breast cancer, you're going to have an increased risk to have prostate cancer. Next one. Of course, there are also environment factors like diet, fatty foods. Tomatoes is like a protective factor for the prostate. And what's the major problem of the prostate is that with aging and with the exposition of the prostate with the testosterone, the prostate cancer can develop. Next one. So what kind of cancer is the prostate cancer? Is an adenocarcinoma. Adenocarcinoma means cancer from the glands. Next one. So what are the symptoms of prostate cancer? So in early stages, you see here, this is an early stage. In early stages, the prostate cancer is asymptomatic. Why? Because there's no obstruction of the urethra. You see the urethra that runs through the prostate. So when we have a tumor, when we have a tumor, the tumor doesn't compress the urethra, so the prostate cancer is totally asymptomatic. The next one. Now, in the following stages, if the tumor is bigger, you can see signs of frequent urination, hesitancy. Nocturia is that you wake up often during the night. Decreased force of urination and organ micturition. And what is the reason? Is the prostate cancer compresses the urethra, so you're going to have symptoms. Next one. So in later stage, you can have urinary retention. These are men that cannot urinate. They need to go to the hospital to have a catheter. Hematospermia is blood in your sperm. Hematuria, renal failure, and pelvic pain. The next one. So in later stage, you're going to see this kind of symptoms. These symptoms are related with metastasis. So you can have pain in your bones. You can have pathologic fractures. Pathologic fractures means that with a simple fall, you can have a fracture if you have a metastasis. You can have edema in your legs because you have lymph nodes in your pelvis. So you're going to have edema in the legs. Spinal cord compression, pelvic discomfort. In this stage, we don't like to see patients in this stage because these are signs of the patient. There's very less to do in this kind of patients. Next one. So the diagnosis, the next one. So the first part of the diagnosis is the digital rectal exam. You see, with the finger, we can access the prostate. The consistency of the prostate normally is like the nose. And what the urologists do, it feels the consistency of the prostate, and you can also feel if there's any kind of lumps. The next one. And the other is the PSA. The PSA is a substance that is only produced in the prostate. So when we have a disease in the prostate, the PSA can increase in blood. So this is the first signal that the prostate needs to be checked if the PSA is higher than 4. The next one. So there's other causes of PSA. PSA is not an exact marker for prostate cancer. So we can see that in men who bike, digital rectal exam, recent ejaculation, they can modify the PSA. So we have to ask the patient what are his habits and what he had been done to access the PSA. The next one. No. So also when we do a PSA, we have free PSA and the total PSA. So there's a high risk of prostate cancer when the ratio of the PSA is less than 18%. So that's very important to measure when the PSA is higher than 4, but not higher than 10, between 4 and 10, we can use the ratio to see if there's any risk of malignancies or not. The next one. So MRI has changed the way we access the prostate cancer, because now with the images of the MRI, we can also know how aggressive can be a prostate cancer, and if the PSA is a benign disease. So doing an MRI in a patient that has a elevated PSA is very important. Next one. So there's a classification of the lesions according the findings of the MRI between PIRADS 1 to 5. 1 is very low risk of prostate cancer, and the PIRADS 5, you have a very high risk to have a prostate cancer. So that's the reason MRI is changed how to access the patient with elevated PSA. The next one. So if the MRI shows that there's a high risk to have a prostate cancer, so we have to do a biopsy. The biopsy, we can do it by the perineal zone or directly from the rectum. So with ultrasound, we can guide where is according to the MRI, we can see where is the area we need to do the biopsy. So, and after the biopsy, we send the samples to another doctor that is a pathologist, and the pathologist is going to tell us what kind of cancer the patient has. It can be less aggressive, like in this kind of cells, or can be high aggressive. So it's very important to know how aggressive is the prostate cancer. So the aggressiveness is we call it is the Gleason score. So the more aggressive cancers are these two groups, and the less aggressive is the first two groups. This one, 7, is moderate aggressive. Next one. So when the pathologists do tell us that the patient has a prostate cancer, we need to do staging. We need to know how the prostate cancer, if it's spread or if it's localized. So we need to order CT scan. We can also order the MRI for the whole body to see if there's any metastasis, and also the bone gammography or scintigraphy is to check if the patient has bone metastasis. This is an MRI. In the darkest, you can see if the patient has metastasis. Next one. This is with the bone scan. We can see if the patient has any metastasis. The next one. So knowing the stage, in short words, we can have three different kinds of prostate cancer. We have the localized one. The localized is the disease is only the prostate. Is not spread outside of the prostate. We can have the locally advanced. That means the tumor is in the prostate, but the skin of the prostate, we call it capsule, or the skin is affected by the tumor. So in this case, we call it locally advanced prostate cancer. And the next one, we have the metastatic one, is when the tumor invades the bladder, or it spread to the lymph nodes and or the bone. So what are the different kind of treatments for prostate cancer? So if we have, that's the reason it's very important to know how aggressive is a prostate cancer, because in early stages with low aggressive prostate cancer, we can do active surveillance. That means we do only follow-up in the patient with PSA and MRI. The next one. So in patients with moderate aggressive prostate cancer, or if the patient has a more aggressive prostate cancer, we can do radical prostatectomy. This is surgery. Surgery means we have to remove the entire prostate and the seminal vesicles. We remove it completely, and we do an hello. Okay. We can remove the prostate by open surgery. The next one. Or we can remove also the prostate with robotics. The robotics means is a laparoscopy technique where the surgeon sits in this area, and with the robots, the robot does all what the surgeon want to do. So we can remove also the prostate with robotics. The second kind of treatment is we have the focal therapy. Focal therapy is quite new. What we do, we localize the tumor with MRI and ultrasound, and with high intensive focal ultrasound, we can destroy the area that we have the tumor. Next one. This is a very important kind of treatment, is radiotherapy. With radiotherapy, we can destroy the cancer cells, giving radiation directly to the prostate. Now the machines are more accurate, so the complication of this technique in the last years has decreased. So we have to understand that prostate cancer is a hormone cancer. So one of the endpoints, one of the goals for treatment is doing hormonal blockage. That means castration. So we need to stop the production of testosterone, and we can do it with this medication. So sometimes we need to give this kind of medication to the patient to stop the testosterone production, and to we can make the radiation more sensitive. Or in patient with metastasis, doing castration is very important to stop the growth of the tumor. Next one. We also have brachytherapy. Brachytherapy is with radiation, with the implantation of radiation seeds, we can destroy also the prostate cancer. Next one. And in late stage, we have chemotherapy. Now, when the patient, the prostate cancer in the beginning is hormone sensitive, so giving medication to suppress the testosterone production, we can see the patient, the patient gets better. But in the evolution of the patient, we can see in the late stages that the cancer turns hormone resistant. So in that case, we need to give chemotherapy. This is all the different medication we use for chemotherapy. Next one. Well, thank you very much for your attention. If you have any questions.
Thank you very much, Dr. Rojas. You may have a seat over there. Thank you very much, Dr. Rojas. We will save the questions for the Q&A section, but right now I want to introduce our next speaker for the evening. And this speaker doesn't like me to call him Mr. Ferrier. I've been reprimanded on several different occasions. Mike, welcome. Mike is a businessman, a local businessman, who was diagnosed with prostate cancer in 2004. He has received treatment in 2005, and over the past 16 years has actively gotten involved in spreading the importance of men checking the health of the prostate gland. Mr. Michael Ferrier.
Thank you. I had my 2 jabs, so I'm going to take off my... Good evening, everyone. And first of all, I'd like to congratulate District Governor Claudio Boncampo, our own, with his promotion, his appointment to District Governor of the Lions Club. I think it's District 60. So congratulations, right? 60B? Good. My reason for being here is to just emphasize the importance of men checking themselves, men making sure that they stay ahead of the cancer curve when it comes to prostate cancer. I was diagnosed with prostate cancer at the age of 54, which is relatively young for prostate cancer. The average age, from what I understand, is approximately 65 years. And it's also important to know that most men will die with prostate cancer, but not of prostate cancer. That is important for you to know. Why I say that is because the opportunity or the chances that someone in his 50s, who is 50 years or more, may have cancer is approximately 50%. The chances of someone in the 60s is 60%, 70s, 70%, 80s, 80%, 90%. That has been proven over the years. It's a fact. So many people will, people that die at 70, in their 70s or in their 80s of heart failure or something else, whatever caused their death, many men will have cancer in their prostate, but it has never bothered them and they never knew about it. So that's why we say they die with it, but not of it. In my case, I was a blood donor for years. I started donating blood when I was 22, and I did that until 2004, when I was diagnosed with prostate cancer. And so I gave blood all those years. And the reason why I mention that is because that's the way I was able to catch my cancer early. Every time I gave blood, which was at least twice a year for 30-something years, I would get a blood test done before they take the blood, and they would let me know the different values, the cholesterol, the sugar, the whatever, and the PSA. So I was able to maintain a close check on my own body with the checks that were being done for when I was given blood. And over the years, all the time, my PSA used to be 0.5, 0.7, 1.1, 0.9. And that was, for all those years, it was like that. Then in 2001, I started seeing an increase in the PSA. It started to go up. And by 2004, it had gone from the 1.2 or whatever it was in 2001 to 3.4 and then up to 5.2, and it started going up even higher. So I went to a urologist. At that time, there was no urologist on St. Martin like we have now. We're very happy that we have Dr. Rojas and Dr. Ramos here now, who can deal with all the issues we have locally. But I ended up going to the French side. There was a doctor on the French side, and he was very, very busy. And I said, you know what, I'm going to try to get to the United States. And I did that and was checked on first over there. In the beginning, they did a biopsy in October, I think it was, of 2003. And then they found nothing. And then the PSA kept going up. And I again went back to the urologist, and they did another biopsy, and they found cancer in one quadrant of my prostate gland. It was in the very beginning stages, and they told me there were different options that I could have. Options that they offered was external beam radiation with external beam. The second one was seeding, which Dr. Rojas just talked about, where they put pellets in your prostate. The third one was high-dose brachytherapy, which is where they put in about 23 needles in your prostate. And the 23 needles are put in what I call a no man's land between your scrotum and your anus. You have you laying down in a bed with your feet in stirrups, as if you're going to give birth. And then they attach to those needles, they attach lines, hoses. The hoses stay attached to you and come out the underneath of the bed. And those hoses eventually get attached to a machine that is called the dosage machine. When I say dosage machine, have you ever seen when you grind meat, how the meat comes out of holes out of the machine, out of the meat grinder, or a spaghetti maker, how it comes out in things like that? The same way they have the hoses that come out, and they attach it to another gadget, and that goes on to a computer. And what they do then is they, and of course, this happens after all the checks have been done that Dr. Rojas was talking about. They do MRIs, they do scans and stuff to determine exactly where the cancer is. And then they send through a computer a radioactive pellet through each line, but one by one. So line one, the pellet runs through the line and goes into you through the needle and sits for a little while and comes back out. They know exactly how long the pellet should be in each one of these needles because they know where the cancer is located. And so the computer applies the time that the pellet goes inside of you and sits at a specific place in the prostate for the time that it needs to sit there to give the radiation directly to the cancer. They do that 3 times. And when I say they do that 3 times, they do it 3 times in a period of a day and a half, 36 hours approximately. And what they do, they take you down, you're on the bed, like I said, with your feet in the stirrups, and they take the entire bed downstairs to the place where the radiation is performed. And there's where they attach the lines that remain in you through the needles that sit in you. They attach the lines to the machine that I just talked about. And then once they've gone through all 23 needles, then they disconnect everything and they wheel you back upstairs and you wait for the next session, which, like I say, is 8 hours later. It is invasive, it is intensive, but it wasn't very painful. It was uncomfortable. But the important thing is that it is they thought because of the beginning stages that the cancer was in, it would be the right thing for me. And I can say that they probably were right, because it was in 2005 that this was done. And we're now living 2021. And my PSA, I check it all the time. I still check it all the time, every 3 to 6 months, depending on what I'm doing. But in the beginning, I used to do it every 3 months, keep checking the PSA to make sure that I stay on top of where I think it should be, so that I have no other complications thereafter. And my PSA has been around 0.1, 0.2 for the last 15 years approximately. So it really worked, and it worked well for me. So external beam, the seeding, which is putting the same pellets that I was talking about, or similar ones that I was talking about, that goes into the line, comes out. They would take smaller amounts and put them in the prostate and leave it in the prostate, in the gland itself. That's what they call seeding. And then, like I say, a high dose brachy, which I did. And then there was radical prostatectomy, which is taking out the prostate completely. Dr. Rojas talked about, they do it laparoscopically right now, and they do it, with very precise machines and precise computers and robots and stuff. When I had the opportunity to choose which one I wanted to do, I did some research and talked to people, talked to friends, other people who had it done, and at those days it was done strictly manually. And that the information I got was the biggest possibility to have side effects like erectile ED. This one, what? Who? That one self. So ED and incontinence, that's the other one, meaning that you can't hold your urine. The biggest culprit of that was the manual removal of the prostate. So I decided I wasn't doing that. And so the high-dose brachytherapy worked out quite well for me. And like I say, now in today's world, with the equipment that they have now, the radical prostatectomy is probably the most chosen way of dealing with prostate cancer. I can only, like I say, my message is to the men who don't want to deal with prostate cancer, because prostate cancer in many cases bring up in people, oh, well, if I talk about that, that means I am not really good anymore in bed, and it's not good for my sex life, so I don't talk about it. It's like blood pressure. People with blood pressure. There's so many men who either do not use their medication often enough or at all, simply because for an erection, you need blood. That's what you need in your penis. You need blood. So if you're going to lower your blood pressure because of the other problems that you have with blood pressure, you probably also sometimes have problems with erectile dysfunction. So men decide, I ain't worrying with that. I want to have a good time. And I say, it's probably better to take your blood pressure medication because it's either you gonna dead or really gonna dead. Which one you want to die? It's up to you. You have a choice to make, and that's how I look at it. Prostate cancer, as was said also just now, it's one of the most common cancers in the world. Skin cancer, I think, is a little bit more prevalent than prostate cancer. 1 in 7 men will be diagnosed with some form of prostate cancer in their life. As I said, the average age of people that get diagnosed is about 65. Can it be prevented? Maybe not prevented, but you can surely do things like exercise, eat fruit. What else we had here? I had a couple of things I had. Control your body weight. Have a correct diet. Sugars, all of those kind of things. Everything con calma, as they say. In the States, approximately 250,000 people, men, are diagnosed with prostate cancer every year. Afro-American, Afro-Caribbean, so people of color are bigger risk, higher risk than Caucasians. And how you go about your life, what you do with your body, you only have one. I strongly recommend that you listen to your body, keep a check, and don't be afraid. Go into things with a positive mentality. When I was diagnosed with prostate cancer, the first thing you go, oh my God, cancer? And then you say, okay, well, what are we going to do about it? How can we go about it? And for me, the glass is always half full, so I think of what it could have been if I hadn't caught it, the problems I could have had. So I thank God that we caught it in time, and I hope that that's all I got to deal with. Thank you very much.
Thank you, Mr. Michael Ferrier. Of course, we have to say it's a good thing for early detection indeed. We're going to move on to our next speaker, Mr. Raymond Benjamin. He's a prostate cancer warrior. Raymond Benjamin is born and raised on St. Martin. He earned his degrees as an electrician and a mechanical engineer as a civil technician for over 30 years with the government of St. Martin. Raymond has always been and continued to be very active in sports. His latest sports is passion and cycling. His other passion includes music, playing the piano, the saxophone, and the flute. And of course, in 2018, Raymond was diagnosed with prostate cancer, and he decided that he was not going to keep quiet about it. Raymond decided he was going to be a prostate cancer awareness advocate and share his story at Christian Faith Ministries International Church in Dutch Quarter in September 2019 during an information session featuring Dr. Rojas and Dr. Ramos. Raymond, strongly rooted in his Christian faith, hopes that by sharing his story, encouraging other men to start the conversation with their doctors on getting screened will make a difference and save men's lives on St. Martin. Put your hands together for Mr. Raymond Benjamin, a warrior.
Good evening, all. Good evening to those, first of all, who have made it so easy for us via this medium.
the organizations, and certainly my two big sisters there for that I could deliver a message tonight to all the men here. First of all, I'd like to start with my personal trajectory with the issue of prostate cancer. For me, prostate cancer was never an existing thing. Growing up with my parents, my grandmother, occasionally you would hear about different sicknesses in villages, different sicknesses such as blood pressure and all kind of other ailments that when they describe it, it would be just a description that someone is sick. But one sickness that stood out for me was they used to talk a lot about stoppage of water in elder men. And yet that left us in the dark as young children. Today, I think I grasp personally what they probably meant. For me, prostate cancer, the first word prostate was when I was around 30 years old. I got married and had a good life, always active in sports. Started built my house, got involved, married, beautiful wife and everything. But by reason of my job, I started to suffer a lot from different pains, got a bladder infection, and also at that time sought help in different avenues, yet remaining busy. I heard the word prostate then from Dr. Asen. And that was the first time that I got the knowledge of which different tests you could have done on you to check your prostate and in connection with your interior organs when it pertains to your bladder and such. Anyhow, treatment in those times was by reason of medication. Take some medication and pains would go. And so it never really dawned on me about taking blood tests and a vast checkup of your body, more so when you're active and you're feeling well because you're young. But as time progressed, you got older and stuff like that. I grew to know that over the years, in my activities and also being involved in different organizations, you get more information and you hear more about more sickness, my body and stuff. I've been involved in sports, so of course, you got a sprain, you got a hurt in your back or wherever you want to doctor it yourself or go to the doctor. But most, as it is in all men, we have an innate way. If the pain is strong enough to obstruct you, you treat it yourself. That's us men. It goes a bit, it may be our ego, our machismo, or whatever, we would get it as being labeled, which is connected also to a truth, because I was part of that demise. So I would go on to say, I ignored a lot of different, pointers as it relates, and we could check early enough if certain pains would relate to your internal, which is faint back pain, pain even in your knees and stuff because you want to keep playing your basketball, you don't want nothing to hamper your rhythm, so you'll overlook these symptoms easily. But however, one thing drew my attention, which is also, in those days, you get an awkward lump on your body. Oh, cancer. Oh, this, oh, that. And one day I got an awkward lump around my knee. It was not related to cancer. However, I went to the doctor and we had a lot of discussions, and he said, Ben, I'm going to get you involved in the management of your PSA, which means it is a parameter in checking your prostate. I said, prostate? Oh, okay, that thing. Yeah, he said, yeah, your prostate. I said, yeah, I hear about it. I heard about this prostate and so forth. So now one time you're also connected with the taboo of the doctor going to point somewhere where you don't want him point and touch somewhere where you don't want him touch. That's also where we as men tend to draw back to get a sensitive check on our body where it relates to this very sickness. So one time I was a bit reluctant. I said, okay, no problem, because he told me, no, don't go and think so deep yet. You could check by reason of blood test. And so between the ages of 41, 42, I started to check this, and it was going pretty easy. I was in the range of 2.3, 2.8, 2.3, 3.2, and he kept assuring me, look, you're okay because the barrier is 4 and down. So once you're in the area of 2 point something to 3, you're okay, that's your PSA count. So it was going pretty well for, let's say, 2.5 to 3 years in between the ages of 41 to 42, 43, 44. It started to increase. When it reached 3.8, he said, Ben, we got to be a little more close up on this thing because it's climbing. However, we balance it off just around 4. He said, look, don't panic because you don't have to think, oh, you're going to get cancer and those kind of, scary kind of thoughts. So, okay, I got a little more comfortable and I skipped 1 year in monitoring. That was my mistake. I'm going to be very personal in divulging mistakes that I made because for me, the sickness is deceptive, and by reason of its nature, us as black men, we could get it in different stages, as the doctor explained. Aggressive, semi-aggressive, and it depends on where you are at. You have to act. You have to act instantly. You have to always be aware of what you're going through then. So at that time, this sickness was so deceptive. I wasn't feeling all the side effects as you may hear or have seen or looking out for. And that's also where I dropped the ball in that 1 year. It climbed from, let's say, 4 to 5.3. And all of us was alarmed, me, the doctor, and my wife most of all. So we started our internal counseling and stuff like that, where and how to go about getting the treatment then. You know, I would be jumping maybe a little bit far in certain areas that I'm explaining, but what I want to say most of all is knowing the deception of prostate cancer is very important. You may be looking out for other pains than the pain that is pointing you the most to what you should be treating. When I was looking out for, you would get problems within your urinary tract or some form of situation with your bladder or otherwise. I got faint pains around my back and other different pains that was also related to this disease. So I was looking here and it was dealing with me over there. So what I did then, I started explaining some other men about my situation, how they feel, what do you think about this? And the worst thing to get also amongst yourself, if you're not truthful with one another and upfront with what you could say is wrong with you, you will get false pity, false sense of comfort, because no man, as in us, really like to say, how are you doing with your prostate? Hey, my prostate's sick. Women, they have the knack to just explain one to the other, hey, I feel a lump here, I feel a lump there, and these things go easier for them. But when we would talk one to the other, we wouldn't really say, well, man, my prostate bad. Man, things ain't going good lately because I can't be good. Those kind of factors, when you seek self-comfort from a man to a man, you may be just falling short also. We got to learn to be upfront one with the other exactly what is going on with ourselves. As women could be comfortable with each other, as relating one to the other, what they're going through. I found that out also. So as it pertains to the treatment and going to the doctor and hearing how much further I should go on with this, we reach as far as knowing, by reason of taking the MRI and the different treatments, that I had to also look into immediately. I had to find out that a biopsy was the other way to go. I mean, I have to jump here and there because a lot of things was explained earlier as to the stages you'll have to encounter when you do reach so far as knowing that your PSA is too high, and now you have to seek treatment as it relates to the possibility of having cancer. So when I reached so far, thank God that we had 2 doctors available on the island, and being confronted with the news as sitting there that particular time, I had to put my mind in another gear as to being faced with the fact of having cancer. How should you be allowing yourself to be accommodated medically, to be healed, to get help? First of all, I have to thank my wife for being there by me all the time, which is very, very important, that you have someone who could keep you stable and calm, and that you have a form of assurance that not only the doctor is there for them as it pertains to you going to him, but when you go home, you could also have that sense of calm and explanation that it is not you alone. I am going through it with you also, because you're my spouse, we are husband and wife, and I am your support. And you have to hear that you'll be healed, you'll be cured. Because well, for a lot of us, maybe we do not have that connection, husband or wife wise, but you can seek help or seek counsel in someone. And I will always advocate that. Get your family on board, one way or the other. And as I was going through this whole situation, my wife was always there with me. And the doctor grew more comfortable where I couldn't speak up. She fell in. And okay, it was also kind of awkward sometimes with what I would relate to him, for, it also would entail her. But in the end, it resulted in me getting the best treatment for both me and my wife. You see? As it would relate to the treatments, when I reached so far as to finding out or counseling with the doctor, which treatment would be best for you? Again, you're fairly young. You get all the scenarios from the worst to the best. It is radical prostatectomy and different other in-betweens, right down to, depending on the stage you have been diagnosed with, a treatment that you can resume your life as normal as it allows you to resume your life. And I'm not saying with a lot of other attachments. I'm saying as normal as you can resume your life, which is Mr. Ferrier, he explained the brachytherapy. I was fortunate enough in between 2004 to now 2019, the brachytherapy stage has advanced quite a bit more. So I took that option also. But the stage has to allow you to take that option. And my treatment was 1 day, thank God, with two dosages of the radiation, which is by reason of the needles connected to you, the hoses to the biotics, which is the machine with the dosage, and the computer. You could be killed from the bottom down and see the whole operation, including how those pellets are treating your prostate. So it is not as though you would be tied down and ready for the slaughter and be butchered on the pain. So these myths and scares is a lot of the reason why we are not so upfront with seeking help for prostate cancer. As men, we tend to get a lot of the negative, but in today's technology, there are more positives in treating prostate cancer than negatives. But we have to be, proactive. We have to want to know more about what is available for us to get this help. And right now, there's a lot of help available for us with the professionals that are available for us, and also with the avenues that allow us to divulge information. I'd like to say quite a bit more, but I have the 5 minutes that I'm not accustomed to, and I'll close it now. And I thank you all for being so attentive to my play. Since I have been treated and released, I'm up functioning, jumping, running, biking, doing everything normal. And have a good life.
Let's hear it for when you know something is wrong, you take action. Man up, check up. Indeed. Thank you very much, Mr. Benjamin. Very powerful. Up next, we have none other than Mr. Julian Rolox. Mr. Rolox's life story is an example of a young person coming from an underprivileged environment, the oldest of 6 brothers, raised by a single mother who made education for her children a priority. Mr. Rolox has a master's degree in biology and chemistry. He is a former teacher at the Milton Peters College, a political consultant and author, and ran a successful business for more than 30 years. Mr. Rolox, you may seem that he's not a prostate cancer advocate or nothing, but in a discussion that I had with Mr. Rolox on DV Little Baby, she says, you know what? I am going to have your audience rolling. I want to discuss the scientific quandary. Does sex affect the prostate? Let's hear it from Mr. Julian Rolox.
Good evening. I'm going to make you one promise. There are 2 things that are going to touch every family and every door. That is sickness and death. There is not one door that sickness and death ain't gonna someday. And if you're ready or not, it's gonna be there. Another point I want to make real quick is that you're not going to get AIDS for free. You're not going to get AIDS for free. It ain't going to happen. As you age, the body gets older. As you age, parts break down like a car. You have to replace them. Some people have to replace knees, elbows, etc. Before going into the presentation, and I'll keep it as short as I can, 4 years ago I had a stroke. At 60 years, 61 years, I had a stroke. And I want to leave this with you, especially men, women too, but especially men that have a lot of false pride. Watch your blood pressure. When you pass 40 years, black men in particular, I'll be very specific because it's a topic. All the races have their problems, all. But we as Black people have specific problems also. Watch your blood pressure. 40 years and up, you should have a blood. I told a cousin of mine, you need a girlfriend sleeping next to your wife. And that girlfriend is your blood pressure meter. You got to take that regularly. In my case, cholesterol was high, blood pressure was not good. But the most important problem that I had was thick blood. And it happens a lot in colored people. And doctor, if I'm wrong, please help me. What you need to do, in my case again, what I did and recommended was take an aspirin, a baby aspirin every day to make that blood flow smoother. That blood gotta, because if you don't, you can get heart attack or you can get strokes. Before getting ill, I was an active guy, doing all kinds of sports, running, going on the beach. Studied biology for 7 years. I thought I'd know a whole lot of stuff. Just that, I never got just that aspirin, I never knew about. But we were created by wisdom, and God knows what He does when He does. All I'm hearing tonight, I'm very impressed with the gentleman that went before me. Very impressed, because all you're hearing tonight is either science or you're going to hear experience. And both, my friends, take them serious. What you're hearing here tonight ain't no fairy tale. And when you're going through it, yea, do I walk through this valley of the shadows of death, because you're really, really walking through the shadows of death. When you're laying down, like one of the speakers, Mr. Ferrier, said before me, and you're going through that procedure, like you're making a baby with 2 legs spread, all kind of things run through your mind. The speaker before me explained his ordeal, his walk through the valley of shadows of death. Getting a stroke ain't nothing to play with. And today you're hearing young people getting strokes. A couple of statistics real quick. Black men are twice the factor of getting prostate cancer above white men. Black men has twice the chance of dying from prostate cancer versus white men. Why? One of our main reasons for these statistics is screening. The PSA, very simple test. You go to the doctor, tell him, I want to check my PSA, he takes a little blood. Next day you go back, you get your score. The big problem with us is the rectal exam. And about a month ago, I had both of them done. And I'm doing it since I'm 40. I just got to make a stop when I did it the first time. My wife sitting there, I'm talking to the doctor. The doctor said, okay, you want to start to do it, your rectal exam, no problem. You got to drop your pants. I said, all right, doctor. Drop your pants. Then he said, well, you got to take off your jockey and stoop on top of the table. I had to ask my wife to excuse us. So, again, a bit of the macho thing. It's very difficult to have your wife seeing a man sticking his finger in your backside. So she excused us, like she always does when I do it. Because since I'm 40, I'm doing it every year. I would recommend you, my dear brothers and sisters, have your husband do it, have your brother do it, have all the male family that you have do the rectal exam. It's easy. You're not no Mariko. Nothing is wrong with you. You stoop, the doctor stick it in, he take it out, he said everything is okay. As the doctor pointed out here earlier, it's a quick exam. It's the best that I have up to now as far as I was made to understand. There's no pain involved. Like I said, a month ago I had it done, and no problem. A little discomfort, but it's okay. I have met in the last couple of months since I'm back, I met 2 families, and the husbands died. They decided they're not going to leave no man stick the finger in the boom boom. They ain't doing it. And they died. 2 different families. Black men. We can't be that foolish. Believe me, don't be that foolish. Do it. It can save your life. Life is precious. Once they put you under the ground, you're there for a long, long time. I tell my children, make sure, give me a good pillow. You're here on earth, you're walking on earth. It's a privilege, it's a blessing. Use it, don't play with it. There's a bad habit that we have. Very, very bad habit. Men and women. Men driving and put a cell phone in their laps. It's a bad, bad, bad thing. You're exposing your testicles to radiation. You're exposing, for men that don't have children, your young sperm cells to radiation. You're exposing your prostate gland to radiation. Put the phone someplace else. With the ladies, you find most ladies walking with their phones on their bottom, in the back pocket. I've studied various, and please, Doc, again, if I'm mistaken, please correct me. You get radiation on that one side all the time, it affects you. Other people take the phones and they put by their heart. Don't do those things. In the closing, and I'm going to leave this question to the doctor. Some doctors say too much sex in. Some doctors say too much sex is no good for the prostate. They have other doctors say no sex ain't good for the prostate neither. So what do? Monks that do not have sex get prostate cancer early. In the studies that I read before this presentation, it was, one study said, a man needs 21 ejaculations per month. That's a busy life. That's a busy life. A man needs 21 ejaculations per month. And a man 40 and above, to stem the chances of his prostate cancer. I would like to leave the doctor tell us what he knows in this respect, because it is very important, because seemingly, if you do not have no sex, in the case of priests and monks, the fluid that's produced in the prostate creates the problem. But if you are sexually active regularly, you flush that fluid out of the system. It's almost like cleaning out the plumbing system of your body. My dear friends, I'm going to leave it at that. And one last thing I'm going to say. Treat your body like you're going to live forever. So treat it good. Treat your soul like you're going to die tomorrow. Thank you.
Thank you, Mynheer Rolex, as I always refer to him. Actually, Mynheer Rolex was my biology teacher, and he was a very, very good biology teacher. I just want to say tonight we learned that we should value our life and take a moment to appreciate the finer things and the people that are around us. We're going to continue with Men Health Matters this evening, moving on to our last surprised speaker, I would say, Michael van Grieken, a Lions member of St. Martin Lions Club, and he's also a local businessman. Mr. van Grieken started the discussion with his doctor about challenges with frequent urination. And just on June 1st this year, Mr. van Grieken had the TURP surgery, transurethral resection of the prostate. And this surgery is used to treat urinary problems that are caused by an enlarged prostate. Today, this evening, Mr. van Grieken is still in recovery, but felt it was important to share his prostate health issue. Help me to welcome Mr. Michael van Grieken.
Thank you, Electra. Good evening, my fellow Lions, guest speakers, and of course, electrolytes in your foundation. I want to single out Dr. Carlos Rojas. Respect to you and respect to your field. Now, going through what I have, enlarged prostate. Now, I'm not going to talk about the surgery itself. You can Google it, see what it's all about. See what it's all about. Oh, okay. You can Google the surgery. It's a TURP surgery. It's pretty intense, but either way, you can Google it. Now, I'm going to speak more about the awareness of how I got to surgery June 1st. Now, my awareness is do not do it the way I did it. Okay, what not to do. Now, I didn't tell this to my doctor, but we're talking now probably 7 to 10 years in the making. Okay, so now this thing starts off, you start to gotta pee at night once or twice. Urination strength weakens, and then there's leakage. That gradually creeps up on you. So now I'm in the IT field, I'm a Googler. So now I sit and I Google and I play doctor. So now I'm going through all the process, you know, there's over-the-counter medication you can buy. And of course at night, you get up frequent. It got up to the point where I'm getting up 6 to 7 times at night. So which means I'm not sleeping. So now I'm gonna counter. I'm busy, I'm a workaholic. I work pretty much 7 days a week. So now, okay, I have to work, I have to sleep. What do I do? Okay, so now I'm gonna play doctor. I'm buying the over-the-counter medication, and then you basically start to mix it. At night, I take one. In the day, I take another one. At night, I'm not sleeping. I'm getting up, whatnot. And then during the day, I start with the coffees in the mornings. And then in the afternoons with the monsters. So now I'm working on a heart attack, and I'm playing Russian roulette with the medication. So now this process has been going on for years. I'm like a robot. Get up, I have to work, I have to do this, I have coffee. I have a coffee in my home, coffee in my office. All my customers have coffee machines, so I know who to go to and get my free coffee. And of course, supermarkets are all over the place to get your monsters. The favorite one is the blue one. So of course, this is what not to do. Okay? Your body is telling you something. It's simple. Go to the doctor. Tell him what's going on. But either way, now the day that I decide to go see the doctor, I go to my doctor, Dr. Perez. Okay, we go see him. Now he refers me to the specialist. So now you start that process. Now you get prescribed medication. You're trying this, you're trying that. Apparently, it got to the point where nothing works. So now obviously I'm avoiding the surgery. Surgery, if you Google that, it's pretty intense, okay, to go through this TURP surgery. Finally, Dr. Rojas tells me, Michael, it's like my father talking to me. I feel like he's gonna curse at me. You need a better quality of life. You cannot do this anymore. You have to do the surgery. There's no ifs, ands, or buts. So basically, it got to the point where I'm at your mercy. Let's do this. And then the day of the surgery came. The day of the surgery is something I can't explain it. As I said, you can Google that part, and then you're going to go through your twitches, and it's pretty intense. But after the surgery, you go through the recovery process. You got the catheter. You got all these things on you. My journey is not over. I still have ways to go. Something you also said, you want to end up in Pampers, Michael? Obviously, you don't want that. So now the journey has started. As I was told that the surgery was June 1st. I'm still with the coffees in the morning, but now I'm changing. Instead of the monster, I probably have 2 coffees. Now I started with the teas. I started with matcha tea, bush tea, different things to try to keep me awake as well. But now it's the follow-ups now. So now that will be the further discussions now going on with Mr. Rojas. So that's where I'm at right now. So the journey is still going. Either way, so the awareness is your body's telling you something, go to the doctor. It's as simple as that. Don't do what I did and play doctor, Russian roulette, and all that nonsense. Either way, thank you for your time.
Thank you very much, Mr. Van Krieken, and we certainly appreciate the point of view of don't do what I did. Thank you again. You can get a little break now. I know we've been sitting for more than an hour, but I promised information, education, and fun. And we've had that. We've had information, we've had education, and we've had a few laughs in between. So now we're going to take a little break. Bathrooms are in the back, and then we will come back, and we will then have the Q&A sections. At this time, if you can move around, but the break will only be for about 5 minutes. And then we will come back for the Q&A section. And then we will wrap it all up. Know that we will get questions both. We're expecting questions from both you as well as from our online audience as well. Thank you very much for your attention, and we will be back in 5 minutes.
Stay with us. You are watching the Men's Health Matters Man Up Checkup Information Session with a focus on prostate cancer awareness. The event is hosted by the St. Martin's Lions Club in collaboration with the Positive and Electrolytes Foundation.
Hi, I'm Dr. John Lynch. I'm a urologist and I specialize in treating patients with prostate cancer. Not only am I a doctor, I'm a prostate cancer survivor, so I know on a very personal level how difficult and scary it is to get the diagnosis of cancer. A cancer diagnosis is never easy to hear, and the emotional impact can be significant. What is important to remember is that, unlike many other cancers, most prostate cancer never becomes life-threatening. And if you've been diagnosed with localized prostate cancer, there are many treatment options available. Although prostate cancer is the most common cancer in men, it's also one of the most treatable, particularly when detected early. If your doctor has told you that you have localized prostate cancer, that means that the cancer has not moved outside of the prostate. You have a lot of very effective treatment options available. Deciding what treatment you should get can be complex. It depends on how much the cancer has spread, known as the stage of cancer, and how it looks under the microscope, known as the grade of cancer. It also depends on your age, health, and personal preferences. Some prostate cancers are very slow growing, and as I mentioned earlier, may never become life-threatening. In these cases, your urologist may recommend active surveillance or watchful waiting. Active surveillance uses regular PSA tests, rectal exams, and biopsies to watch cancer. If the cancer begins to grow, your doctor may suggest treatment, such as surgery or radiation. The goal of active surveillance is to allow you to keep your quality of life. This is often a good choice if your cancer is not expected to grow quickly. Active surveillance can give you years without any side effects that may come from treatment. Watchful waiting is sometimes used to describe the less intensive type of follow-up that may mean fewer tests and relying more on changes in your symptoms to decide if more aggressive treatment is needed. This option is more often used with elderly patients or those struggling with other health issues, as well as their prostate cancer. Two other common forms of treatment for localized prostate cancer are surgery and radiation therapy. Surgery, known as a radical prostatectomy, is removing the prostate and the surrounding organs known as seminal vesicles, nearby tissue, and some nearby pelvic lymph nodes. Radiation therapy uses high-energy rays to kill cancer cells. Radiation can be offered externally or internally. When internal, it's most often using implanted radioactive seeds. There are other treatment options available, but those that I've mentioned here tend to be the most commonly used. So how do you determine what is right for you? Get a balanced picture of the pros and cons for all of your treatment options. Learn up front about potential side effects and what you can do about them. Talk to your urologist. Together, you can look at your overall health, the facts about your specific cancer, and what is important to you. No two prostate cancer patients are the same, and everyone's journey is different. Localized prostate cancer is very treatable. Take control. Talk to your urologist and start your road to treatment today.
Men Health Matters is brought to you in part by Bin Pharmacy, Prime, Gillette, Old Spice, Fiji Water, International Liquors and Tobacco, Hillsburg Broadcasting, My 88, PJD2, Viva Science. Special thanks goes to Onda Grafica, LCA Studios, Rentasal, Telem, The Daily Herald, and all media outlets. Aging with Grace, Dr. Anders Linder Richardson.
to do a follow-up. In prostate cancer, the best follow-up test is the PSA. The PSA is a simple blood test, so you can see with the PSA, with the blood test, how is the activity of the prostate cancer. So if we see that the PSA increases after therapy, we can suspect a recurrency.
Yes, sir, you can proceed with your question.
Okay, my question is, I'm 39 and I recently checked my prostate, and I'm still young, but how frequent do you test it? You check for any prostate cancer? How frequent do you do the test, the PSA test?
The guidelines for prostate cancer says that if you have a past family history, you need to start your screening earlier at 40. In patients with no family history, they should start at 45. The blood test is the best way to do screening. Recently, with all we have seen prostate cancer in very young patients in the 30s.
Sorry, my question is, how frequently do you test?
Yeah,
like 3 months, 4
every
months?
year.
Every year?
Yearly.
Thank you.
Thank you for your question. Any other questions from the floor? Go ahead.
Good evening. Where in St. Martin can someone go to get an annual screening? And especially if you're uninsured, where can you go to get screening? And second follow-up for both Michaels, what can we do to make the exam less scary?
Mr. Ferrier?
The question for me was, what can we do to make the exam less scary? Well, it's really not scary. It's just uncomfortable. The digital rectal examination is the one that most men kind of, I don't want, because of the fact that, like you say, somebody poking around someplace where you don't want people to poke around. That's the bottom line, basically. I know I always make the joke. I say, after my 2 biopsies, I was 100% sure that I'm a heterosexual. But again, I don't think there's any kind of illness that you may have that doing tests are nice. Colonoscopy is not nice. Endoscopy is not nice. So there's all kinds of different things. There's people not taking the vaccines against COVID right now because they're afraid of a little needle or they're afraid of other things. We're not going to go there, but so anything that has to do with your health, people kind of shy away from. But again, you have to weigh the situation. Do you have the cancer in your family? So do you have, is it hereditary or not? Do you have issues like my friend Michael here has, where he end up not sleeping at night and having to get up every time to go to the bathroom? You have issues that you can weigh which is worse, dealing with it or getting it dealt with. And I say, and he says, and the doctor says, deal with it.
And about the first question is how patients not insured can do the screening. Well, of course, in COVID times, everything changed. But before COVID, we had a nice experience in the hospital. We did a campaign. So a lot of men, not even insured, they visit. We did a one-day checkup. We saw around more than 100 patients.
150.
150. in a single day. Of course, everything changed with COVID situation. So if there's more restrictions, we cannot see a big amount of patients in one time. But of course, a non-insured patient is difficult. They only need to do the blood sample and they need to go to the hospital. But in the future, we want to do again this kind of campaign to help the non-insured patients.
Just to add a little bit more to what Dr. Rojas said, in 2019, the St. Martin Medical Center partnered with the foundations, the Positive and Electrolytes Foundation, and we launched the Prostate Cancer Awareness Man Up and Check Up. At that time, as he pointed out, we were able to rally over 150 men to come to various locations, including Napa and Koiman, and they registered and they were given a prescription to take to the lab to get the PSA test done. Then the generosity of the St. Martin Medical Center and Dr. Ramos and his team, and Rojas and their team, they facilitated one day basically reading those prostate exam results, the PSA results, and doing physical examinations. And it was very, very intense, and it was awesome to see that much men turn out for that screening. Discussions were held then at that time that we will repeat the session again in 2020, September, but then COVID hit. But we have, while it's on the back burner, it is still something very much that we intend to pursue and to continue. Given the turnout that we have tonight and on our online viewers, we definitely see the need for this type of treatment and these types of sessions. And it is something that the foundations will definitely be looking to pursue. Any other questions from the audience? We ask you if you have a question to kindly stand at the microphone so that we know that this is, that you have a question.
Good
Thank
evening.
you.
Good evening to everyone, and thank you to presenters and of course the organizers. It was said that black men or African American men, because of the region, are affected more by prostate cancer. What about those that live in Europe or Africa itself? Is it the same thing?
It's the same. Also, what we see, there's some population in northern countries like Sweden, Denmark. They have high rate of prostate cancer, but in Afro-Caribbean, Afro-Americans, the cancer seems to be more aggressive. So they have a higher rate, and the prostate cancer seems to be more aggressive.
Just final question, because you also mentioned the issue during the slide of the diet as to what you eat. So in other words, I can almost say that we are eating less healthy than the Caucasians then.
Yeah, of course.
More susceptible.
You can.
Not necessarily less healthy, but more susceptible. People of color are more susceptible to the prostate cancer issue than Caucasians.
So you can have, being Afro-American and Afro-Caribbean, you can have the you can have more, the susceptibility to have prostate cancer. But if you don't take care of your body, you don't eat healthy, you don't exercise, you're going to have even more higher risk to have prostate cancer.
Thank you very much. Just a remark, I want to also encourage men, because what I do and what you said is very important. Whatever problems you feel in your body, go and get a checkup. I do it every year. I used to do it twice a year, now I do it once a year. So go and get a checkup. Thank you very much.
Thank you for your question, sir. Go ahead.
Good evening. My question is, I know there is support for breast cancer awareness. Is there a support for prostate cancer or persons that have gone through that on St. Martin?
Currently, there is no official body that has been established to do prostate cancer support. And we are definitely struggling in terms of breast cancer support as well. So it is something that we have thought of. We don't necessarily have the mechanism in place. But if you reach out to one of us, one of the foundations, we can direct you to someone that you can talk to. Let me not say Mr. Michael Ferrier has always been very willing to share his expertise and his survivorship story. And he would be more than willing to talk to somebody on a one-to-one basis. But no formal support organization currently exists.
Thank you.
Thank you for your question.
The only thing I don't deal with is if you're pregnant. I'm not dealing with you.
Yes, go ahead.
There's another online question, and the online question is asking, on average, what is the age should men begin getting regular prostate cancer checkups and colonoscopies?
Colonoscopies?
Yeah, that's what it says, yeah.
No, well, I can say about prostate checkup after 45 years old. Colonoscopies, after 50 years old, I think the colonoscopy, all men, all patients, not only men, even women, they need to do colonoscopy.
Yes, sir, you can go ahead and pose your question.
Good evening, all. My question is, frequent urinating is a way of detecting that you have prostate cancer? Or is there other ways that your body can tell you you're having the symptoms or anything like that?
As I was telling in my presentation, in the early stages, prostate cancer has no symptoms, but BPH is prostate enlargement, is very common between men. 3 of every 4 men, they're going to have enlarged prostate. And those symptoms, those urinating symptoms, you see it after 50 years old. The way you urinate changes. So while the prostate grows, you're going to have more symptoms. So what we see is that patient that is going to see his urinating symptoms, we can find in those patients prostate cancer.
Okay, thank you.
I have a question for the Michaels on the table and Mr. Raymond Benjamin. And the question is sex an important factor in having a healthy prostate? What has been your experience?
Say that again.
Is sex an important factor in having a healthy prostate?
I think sex is an important matter, period. So what is your next question?
Well, my next question would be, how has the health of your prostate impacted your life?
Mine?
Two Michaels and Mr. Benjamin. Raymond.
Okay, I'm going to answer for me. The type of treatment that I had, they told me what the possibilities would be. Like I said, you could, because of, I not only had the high dose brachytherapy, I also had external beam radiation after, which they thought was necessary just to make sure that they get it all. And the external beam radiation is what could cause possible erectile dysfunction and incontinence. I was lucky, and I can say that very little problems. In the beginning, I had some issues, but nothing that could not be helped with some help. And that help was done with regards to pills and Cialis and that kind of stuff. But that only lasted about a year, not even a year. And after that, everything turned out to be absolutely fine and dandy. Thank you so much. Thanks for asking.
You're welcome. Any other feedback from the other Michael and
So this
Raymond?
was erectile dysfunction?
No, just the prostate health issue. What impact did it have on your life?
Oh. Impact on my life. Well, as I stated, the sleeping problem. So relationships is going to be a problem because I have problems sleeping. And of course, hanging out with the guys. Everything is go to a bar and drink. So I haven't drank in a few years because of this problem. So indeed, it is a problem when your social life definitely changes. But either way, it's not something that I worry about. Right now, I'm dealing with the problem first. You know, your friends might, tonight is the first time I'm telling my problem. I know somebody calls me and says, Mike, let me go out. I say, sorry, I'm working. Or to go to a date, sorry, I can't. I'm dating somebody else or whatever. You know, so basically, it is a problem, but not something that I'm going to worry about now. You understand?
Thank you. Raymond, any feedback from you?
As it would relate to me explaining this again, it would be, it is so much easier because my wife was throughout the process with me from the beginning. So a little joke, I wouldn't have had to sneak her in here to feel more comfortable in answering this. See, the thing is, I would always have want to function as normal as possible, intimate with my wife. Thank God, she being there with me, it makes it much easier that I have a 98% way of functioning with her, normal as possible. It have no effect.
Good evening. I'm I should say, a surviving breast cancer patient. Now I have a son. And my question is I understood there are ways to do different tests to see if a mother can pass that on to their child, be it a boy or a girl. What can you tell me about that?
Well, that's the future. We're seeing now the future, because in patient that has those families that they have members with prostate or any kind of cancers, we're dealing with the genetics, because all about is genetics. You have you have the susceptibility to have a cancer according your genetics. If you expose to environment like fatty foods or any other else, you can have you're going to have the risk of having prostate cancer. So now we're seeing that doing genetics, detecting mutations in some members of the family, you can avoid a lot of cancers. They're doing it in ovarian cancer. In prostate cancer, we're dealing, but in late stage. So we're giving genetical treatment in late stage prostate cancer, but that's the future.
Okay.
We don't have it yet, but it's going to be like that.
In a case as such, from what age should that child then start testing? Should they start testing before 40 or just wait till they're 40 then?
40 years old.
Thank you.
Good evening. There is another online question for Dr. Rojas again. If one is in remission, how often should he has a PSA done?
Can you repeat the question?
If one is in remission, how often should he have a PSA done?
What I understand is in the question is once a year you need to do the PSA. Once a year. If the PSA is normal, if we see the PSA is increasing or sometimes it's like a roller coaster goes up and down, the follow-up, you need to do it more often. One other thing I want to state is about sex and prostate cancer. There's no link. You can, there are some patients that they don't have sex, or patient that they have more than 21 ejaculation, but there's no link between the how often you do sex and prostate cancer.
Are there any more questions from the floor? One more question, and then we'll close off the Q&A.
Good evening. Mr. Van Grieken, you mentioned that Dr. Rojas told you if you want to end up in Pampers. What stage, Dr. Rojas, at what stage would he end up in Pampers if he didn't take care of himself?
Of course, the urinary symptoms are very, they're not life-threatening, but they affect the quality of life. If you have an overactive bladder is a condition that is very common even in Caribbean women. Overactive bladder is those women that reach a place and they're, hey, where's the toilet? Oh, the toilet is there. Or they're in the cinema, and the best part of the cinema, they go to the toilet. So the overactive bladder is very common, and sometimes if you don't get treated, you're going to finish wearing Pampers. So it's same. It happened the same in men. Overactive bladder in men is more linked in prostate obstruction. If you have prostate obstruction, your bladder develop overactive. So to treat the overactivity in men, you have to unblock the bladder. That's the what we call the TURP surgery.
Thank you.
You're welcome.
Thank you. Thank you very much for all your questions. We will wrap up the Q&A section now, but please stick around with us. We're doing this predominantly for the online viewers that we need to wrap up the Q&A. We will now invite the president of the St. Martin Lions Club, Mr. Alphonse Gums, to say a few words to you, but we ask you not to leave. We're going to wrap this up, but the conversation can still continue after we've closed off the online streaming. Thank you again for all your questions. Thank you for coming out this evening. Stick around. We've got some snacks and some goodies for you, and we would really enjoy your company for a little while after to interact with our panelists as well. Mr. Alphonse Gums.
Ladies and gentlemen, online viewers via social media, my fellow Lions, good evening. I am Alphonse Gums, the current president of the St. Martin Lions Club. In 1 Thessalonians chapter 5, chapter 18 tells us, in everything give thanks. On behalf of the Positive Foundation, the Electrolytes Foundation, and the St. Martin Lions Club, it gives me immense pleasure to be able to deliver the vote of thanks this evening. This Lionistic year, the St. Martin Lions Club celebrated its 50th anniversary. And as a club, we are extremely proud to end our anniversary year with this health awareness lecture, as we were not able to host our annual Lion Rudy Hoover Health and Wellness Fair for the last 2 years due to COVID. We found that it was really important for us to have this event this evening. Tonight, we were exposed to a vast majority of information and testimonies from several prominent men in our community on prostate cancer awareness. As a theme of this awareness lecture was Men's Health, Man Up, Check Up. I hope that we men here in the audience and those online will take the information provided, and I hope that it will encourage us, especially those of us who was hesitant before, to take that bold step and man up to go and get checked up. First of all, I would like to express our thanks and appreciation to you, Dr. Rojas, for educating us on what exactly is prostate cancer, how it is contracted, and when we should go and get checked, as well as the symptoms associated with it. You also provided us with various methods of treatments and made us more aware of this disease. I believe that most of us are now ready to take that next step to get checked up. To Mr. Ferrier, a prostate cancer survivor, we thank you for your testimony tonight. Your testimony has been encouraging, and your experience shared with us has shown us that it's not a shame to be diagnosed with prostate cancer. Thank you. To Mr. Benjamin, a prostate cancer survivor and warrior, we say thank you for those encouraging words and for helping us to understand that our health matters. To Mr. Julian Rollocks, a men's health advocate, we say thank you for being real with us, for reminding us that all of us will be affected somehow if we don't take charge of our life. Thank you. To our own Lion Michael, we thank you for sharing your story with us and taking us on that journey that you took and reminding us that we need to take care of our health one day at a time. To our sponsors and partners, Bainio Pharmacy, Positive Foundations, Electrolytes Foundation, Mr. Ray Simmons and his crew, the St. Martin Lions Club, and all others that contributed in one way or the other for making this event a success. Thank you for your tireless efforts and for being part of our 50th anniversary celebration. Last but not least, to everyone present here this evening and those on social media, we say thank you for taking the time out of your busy Saturday to be here with us this evening. We know by the turnout that this is a very important topic, and all of us want to get the information to be able to get our life better in check. We hope that the information provided was helpful to you and will guide you into taking that next step, as we know that men's health matter, and as we men will man up and get checked up. Thank you very much.
Thank you, President of the St. Martin's Lions Club, Mr. Alphonse Gums. Well, sir and gentlemen, we have come to the end of our presentation. Shelley, I'll ask you to come and stand here with me. Of course, this would not be possible if we didn't have the support of the Lions Health and Wellness Committee. And I just want to ask them if they can come up. Richard, Dennis, John, Jimmy. Did I forget anybody? Aurelie. This has been a wonderful, wonderful collaboration. Elton, we forgot you, Elton. A lot of work has been put into this presentation here tonight in this collaboration with the St. Martin's Lions Club, the Positive Foundation, and the Electrolytes Foundation. We want to thank all the viewers online. We want to thank you for coming and showing the interest in this Health Men's Month, because indeed, men's health does matter. And together we can break the taboo. And we are going to say, man up, check up. Thank you. And now for the goodies provided by our sponsors, Gillette, Benu Pharmacy, ILTT, not forgetting those wonderful, wonderful persons that just give of themselves anonymously. We've got to thank them as well. So let's enjoy the goodies, because without the business community, this event would have not been able to take place. So thank you so much to the business community. Thank you. Shelley, any words?
Thank you all for coming out. It has been a pleasure. Look out for us come September when we will again do a prostate cancer awareness, and for October when we do breast cancer awareness. Month-long campaigns, people, so keep an eye on us.
Stay with us. You are watching the Men's Health Matters Man Up Checkup Information Session with a focus on prostate cancer awareness. The event is hosted by the St. Martin's Lions Club in collaboration with the Positive and Electrolytes Foundation.
The prostate is the gland below a man's bladder that produces fluid for semen. Prostate cancer is common among older men. It is rare in men younger than 40. Risk factors for developing prostate cancer include being over 65 years of age, family history, being African American, and some genetic changes.
Symptoms of prostate cancer may include problems passing urine, such as pain, difficulty starting or stopping the stream, or dribbling, low back pain, pain with ejaculation. Your doctor will diagnose prostate cancer by feeling the prostate through the wall of the rectum or doing a blood test for prostate-specific antigen, PSA. Other tests include ultrasound, X-rays, or biopsy.
Treatment often depends on the stage of the cancer, how fast the cancer grows and how different it is from surrounding tissue helps determine the stage. Men with prostate cancer have many treatment options. The treatment that's best for one man may not be best for another. The options include watchful waiting, surgery, radiation therapy, hormone therapy, and chemotherapy. You may have a combination of treatments.
Men Health Matters is brought to you in part by Benu Pharmacy, Prime, Gillette, Old Spice, Fiji Water, International Liquors and Tobacco, Hillsburg Broadcasting, My 88, PJD2, Viva Signs. Special thanks goes to Onda Grafica, LCA Studios, Rentasal, Telem, The Daily Herald, and all media outlets. Aging with Grace, Dr. Anders Linda Richardson, St. Martin's Lions Club, St. Martin's Lion Health and Wellness Committee, the Positive Foundation, and the Electrolytes Foundation.